A life more ordinary. Commuters back. There's bustle on the streets. Back to bars and dance floors, and not just those in nightclubs. But it turns out the roadmap that brought us here might not be irreversible after all.
COVID is still out there. The disease, sadly, still remains a risk.
The Prime Minister back in the Downing Street briefing room with a warning and a plan.
In essence, we're going to keep going. We will continue to offer testing, and we'll continue to urge everyone to be sensible, to be responsible, wash your hands, use ventilation, consider wearing a face covering in crowded places.
There is a but coming, because those face masks might not be up for consideration if Plan A, including booster jabs for over 50s, doesn't do enough.
Legally mandating face coverings in certain settings.
Masks required by law in some places and unpopular with some on its own benches, among the measures under Plan B for England, as outlined today by a health secretary who 2 days ago ruled out vaccine passports.
And whilst we're not going ahead with mandatory vaccine-only COVID status certification now, we'll be holding that power in reserve.
Also under Plan B for England, the workers starting to re-inhabit offices will be asked to go back to working from home.
I'm used to it now, innit? It's been a year now, I'm used to it.
Fine by some, inevitably not for others.
So I think we had something right at the start of March.
At this business, the uncertainty means an event space booked up weeks in advance pre-pandemic is still empty.
We know that car traffic is back up to its pre-pandemic levels, very close to it. But we don't actually know where people are going, since we hear from employers that they're not necessarily going to work. It feels like we could be getting back to normal, but it seems like every time you build up a bit of hope, you have a bit of a disappointment when things don't go as planned. And I suspect that's why our events space is empty. People want to plan ahead 1, 2, 3 months in advance for events, and they can't do that at the moment.
Not back to normal.
Not back to normal for us now.
As we head into another winter, the strategy is about how to carry on. But although at least 80% of over 16s across the UK have been double jabbed, compared with 12 months ago, the case rate is higher. And increasingly, older people are being affected. Take Leeds, for example. The case rate among over 60s has risen higher this month than at any time since November last year.
It wouldn't take many doubling times to get into trouble, and therefore people still need to take this disease very seriously, because I don't think you need a medical degree to know that autumn and winter is when respiratory viruses are hugely advantaged, flu and others, as people come together indoors, windows closed and so on.
At St Anthony's Parish Hall in Leeds, the newest recruits who signed up to have fun after all the staying at home, Denise and Marlene, both relieved, they say. They'll soon get a third jab, but concerned about the winter.
It worries me how rife it is just now. And it's going up, its rate, isn't it? And people dying's going up. It just mesmerises me. I can't understand it, you know. You think you're going to all be all right, then it all comes back.
After lockdowns and tears, the vaccine, the variants and a roadmap. Now, a plan for winter, with many hoping it will keep life carrying on.
Well, our political editor, Gary Gibbon, was at the Prime Minister's press conference this afternoon and joins me now. Gary.
Well, one of the questions a lot of people are asking about Plan A, Plan B is what gets you from Plan A to Plan B? What are the numbers that change on the dials? Is it infections? Is it rate of mortality? And what seems to come across, it's all of those things, the government says. It's lots of things. You put them all together, but you talk to officials privately and they say the fundamental thing they're going to be keeping an eye on is pressure on the NHS. Is it intolerable? And that is what could get you from A to B statistically. What it is that changes the dynamic, though, of the illness, what it is that contributes to that problem, well, I asked Professor Chris Whitty about that, the Chief Medical Officer for England, in the press conference, because a lot of people are thinking that maybe it would require a new variant, one we haven't encountered yet, to get us from, as it were, A to B. And Chris Whitty seemed to suggest that actually, no, the variant we've got might just do the job quite comfortably. Is it most likely, do you think, that it'll be a new variant that would actually change the game here? Is that the real game changer?
We have not faced a winter with the Delta variant, so it is possible that the combination of winter events plus the Delta variant, which is highly transmissible, could lead to a situation where, on the basis of the data, ministers decided that they wanted to trigger all or some of the Plan B, as the Prime Minister's laid out.
Obviously, one of the things people are wondering about is there a Plan C? Well, there is, but it only takes up a few words in this government document on the winter plan. Should Plan B not be sufficient, we're committed to taking whatever action is necessary as a last resort. That means not lockdown light, Plan B, but full fat lockdown.
Well, the winter plan was, of course, well trailed. Were there any surprises, Gary?
I think what surprised some people was the tone with which the government dealt with the whole issue of COVID passports. Boris Johnson, the Telegraph writer, would have mocked anything like a demand for papers or anything like that, and he sounded as though he was in that place. Certainly other members of his government have sounded like they're in that place quite recently. But when you look into this document, what they're talking about is that will very much be part of the toolkit for Plan B. They'd have to come back and get a vote in Parliament to actually get it, to allow them to do it. But for certain events, over 500 people, not for restaurants and pubs, Boris Johnson was very clear about that, COVID passports might well be part of the toolkit. And you can hear in this little section of the press conference, Boris Johnson really does talk about these things in quite a positive tone. On vaccine passports, you said in this building in July, you served notice that you're planning to bring them in. Were you really planning to bring them in? Were you just trying to get the numbers up of younger vaccination? We've then had lots of other mixed messaging, which isn't great in public health. What's going on?
There would have been a total game changer, a lifesaver last year. And so I think that they're important to, they're an important part of our repertoire.
Well, talk to Tory MPs and they don't speak so positively, some of them, about the whole idea of COVID passports. One former cabinet minister said, it leaves me sick to the stomach. And another one said that Boris Johnson would need Labour support if he tried to get that through the House of Commons. The Labour Party has an equivalent thing to passports to get people into its conference. The other day, Number 10 was trying a passport system at the gate here when they had a reception for Tory MPs. You had to show your QR code. The Tory MPs just stood there and said, well, we're not coming then. And Number 10 folded.
Gary, thanks very much. With me now is Andrew McDonald, who's a professor of virology at the University of Leeds. On the booster shots first, have you seen this evidence that they are actually needed?
Yes, I think this is really positive news that the government has announced, and it brings us in line with the majority of developed nations. And numerous studies, including from Israel and including from Public Health England in the UK, show this waning of immunity in the elderly, and in clinically vulnerable cohorts after about 4 or 5 months post-second vaccination. And so the hope is that by having this third dose, that will give their immune systems a bit of a kick and allow them to fight off SARS infection.
Well, obviously, that's Plan A, and it'll happen within days. But then there is also Plan B. And when you look at the figures, compared to this time last year, where there were 4,000 daily cases and 1,000 in hospital, today, what we've got nearly 27,000 daily cases and 8,000 in hospitals. Do you think the government's going to need to roll out their Plan B sooner rather than later?
Yes, I think they probably will. And I have to say, I think their idea for Plan B is a little muddled at the moment. Many of the mitigations that they mentioned that they might bring in, I think could be brought in now and would cause minimal disruption to the public, such as mask wearing, for example, for those who can, to remain working from home. Obviously, those who are it's essential to be in, have to be in, but there are many people who can continue to work at home. And it's been shown that working from home is an essential breaker actually in transmission and has been really associated with keeping the number of cases down. So I think they should keep some of those mitigations in place now.
Press the button on Plan B then.
Yes, absolutely.
What about vaccine passports for things like clubs and, crowded events?
I think that's a good idea for these large, crowded indoor events. Again, the thinking seems to be a little confused. 1 minute they're in, 1 minute they're out. I think Scotland is going ahead with this. I think the rest of the UK should follow suit.
Right. I mean, we heard just then Gary talking about these measures being a kind of lockdown light, and actually they haven't ruled out a full fat lockdown, as he put it. Do you really think that might be necessary this winter?
I would really hope not. I would hope that the increase in vaccinations and the introduction of vaccinations for 12 to 15-year-old, coupled with the boosters, should provide sufficient protection for the bulk of the population. But if we don't get a handle on this increase in cases soon, then we could inevitably be looking at that. And I think that is an appalling failure on our public health behalf.
Well, we're in a school. Surely it's better to think the unthinkable, bring every measure in before you have to close schools again, to the great damage of children's education. Would that, in your view, include mandatory vaccinations?
So I think there are other measures before you go to mandatory anything in terms of vaccinations. I think there's still a lot of hesitancy, a lot of concern amongst parents and children about the benefits of the vaccine because of this strong anti-vax feeling that we've got, coupled with this sort of delay of JCVI's decision on vaccinations for 12 to 15-year-olds. But, you look at America, you look at many parts of Europe, and they have some of these mitigations in place for school children, ones that are not intrusive, will not affect their education, and yet will help to dampen down these transmission chains and hopefully keep cases down, hospitalisations down, and allow society to continue without going down this lockdown route.
Professor Andrew McDonald, thanks very much for joining us.